Good afternoon, Dr. Frankovich. We're just going to ask questions for the April 8th media availability. The first question is, in order to comply with the governor's demand for expanded testing, will Humboldt County be asking the state for additional resources, add local staff, or simply rely on current levels of ability?
So, great question. We have been in ongoing conversations with the state, of course, about what might be available in terms of their assistance with testing. And so I would say that is an ongoing conversation. At our current testing, we again are trying to maximize our internal capabilities. So making sure that we run to as much capacity as possible and figuring out if there are some other technologies that we can access that will allow us to do it even better. Right now, again, limiting factors are supplies. And even if you have equipment present to do things a little bit differently, we have to have the reagents that allow us to operate. And so we are in a constant quest and queue to get some of the things that might help us add even more to our ability to test. So I would say, again, it's a process in the works, and we're aware of the need, and I think we've made the state quite aware of that too.
When will the county be able to offer COVID testing to community members that do not meet the narrowly defined CDC criteria?
So we are not strictly using the narrowly defined CDC criteria. However, we do prioritize specimens, and it approximates that criteria, because we do have to ensure the most rapid turnaround time for individuals where the stakes are a bit higher, in the sense of congregate, people living in congregate settings, hospitalized patients, healthcare workers, where there are big implications if we have a positive test and we need to respond quickly. Commercial testing is available as well, and so providers are able to use that option for individuals who may not meet those specific criteria, but for whom they have a high index of suspicion of COVID infection. And again, we are not in a point right now, and we will not be at any point in the immediate future of being able to do surveillance testing that is for asymptomatic individuals per se, or even for those very mildly ill individuals for whom there are not additional risk factors or issues. Our hope is to be in that place for a lot of reasons, some of which are just, again, surveillance for public health, and some of which is to address, resident concerns and help the process locally, but right now we're not there.
Thank you. Are healthcare workers and other frontline workers having to reuse their same masks and other PPE for days at a time? And if so, what can be done to change that?
So right now, I think our facilities are in fairly good shape with their PPE. Everyone, however, is envisioning a time where we might not be, and so looking at extended use and reuse, and some of that can happen on the front line to protect the back line, right? And so we are looking at that, and there are some increasing options coming out there to be able to safely reuse, for instance, N95 masks. And we are looking at all of those. And I'm sure facilities will be implementing some of those as well as we continue on.
You answered this in part, but I'll just ask again. Is surveillance testing a method Humboldt County will utilize?
I'm very interested in doing surveillance testing when we have the capability to do that safely in terms of the other demands we have on our testing. So absolutely.
Thank you. After shopping at a store, should residents disinfect their items, or are there other safety precautions they should take?
Again, a good question, and there isn't a lot of good data out there. I think the most important thing is that people wash their hands when they are returning home and unpacking and doing that sort of thing. I think that for instance, for grocery items, washing your fruits and vegetables is something we would do anyway and recommend. I think that for other products, again, there isn't really any strong guidance about this. If people can choose to, for instance, wipe the outside of packaging that needs to immediately be put away in the refrigerator, example, if they want to do that. And they can also use a strategy if they're concerned about, leaving things that don't immediately need to be used, off to the side for a few days, and then implement those back into their use. So again, if there are really good guidelines developed, we will share those as well. But right now, those are the suggestions I have.
Thank you. Last week, you mentioned that public health is developing its own models to better predict the peak of the virus locally. Based on those models, should residents still be bracing for the peak of cases? Have we already passed that point? And will that model or information be made public?
Sure. So modeling is really important. The problem is that right now it's hard to really have a strong model. There are just so many unknown factors right now. For instance, one of the things that you use in modeling is how much transmission you are predicting from one person to another. So is one person likely to infect one person, two people, three people? Those factors have a huge implication in a model. I think in our social distancing, what we're going to be able to do, and actually maybe even seeing already, is the ability to decrease the number of people that each case infects. And with that in mind, all of the models are readjusted and retooled. So what I'd like to tell people is that as soon as I have a working model that actually we have faith in, that makes sense, and that people could actually plan around, we will put that information out there. At this very early stage, we just don't have any strong model yet that people could really rely on and use. The other important thing to realize is that we are nowhere near a peak of cases. We have had a total of 50 cases identified in our county confirmed, and we know that that case count is going to go up. And when we have an idea about our expectation in surge, as we call it, sort of in peak cases, I'll be happy to give that information. We just don't know that yet.
Thank you. You've already answered questions about surveillance testing. So what is your opinion on the effectiveness of remdesivir and hydroxychloroquine as treatments for COVID-19? And are health officials looking into trials, reutilization of these drugs locally, other than the trials at St. Joe's and Eureka?
Well, I would say every therapy that might be helpful is on the table, for sure. The antiviral medicine, the remdesivir, is certainly something that is being used in compassionate use and research trials. And I think we will be engaging in that locally as well. The anti-malarial medicine is another medicine that has been tried, and there are some protocols for use of that as well. And that happens on the clinical side. And I think that there are also other potential helpful measures that are out there. Again, most are available at this point on a research and academic basis, which doesn't mean we can't participate, but there are some hoops you have to go through to do that. So it is all on the radar of our local healthcare facilities as well as public health. And if something is approved for use and there appears to be benefit, we'll be looking at all of those options for local residents.
What prompted the updated list of allowable services that was released today?
Well, when we did the original order and then reissued, we did not reiterate on the new list everything that was already made clear, I think, in the order. The list was really an attempt to clarify some of the grayer areas and to address questions that we had gotten. So my recommendation for people is if in the first instance they felt that they were essential and now are not, or just have questions about the process on that, they can certainly call the 441-5000 number for the Joint Information Center and get some help with clarification.
Thank you. What will restrictions on our lives look like by the end of May or by Christmas? How long do you envision the stay-at-home order continuing?
I wish there was a really great way right now to predict that. What I would point out to people is that right now the shelter-in-place order that we have is accompanied by the governor's order. And so right now, ours becomes in that sense, a moot point because the governor's order is there. I think the more difficult question will be if that at some point the entire state does not need shelter in place, but individual areas of the state that are further behind on the curve, whether those areas still have some utility, and that we'll have to just see as we move forward.
Other places have seen second and third waves of infection. Do your models suggest that in this case? And if so, when might there be a second wave? What measures should we all take to flatten the curve?
So I think, it's important for us to consider the fact that there may be additional waves. One of the factors that will likely influence that is how we unfold all of the measures that we've put in place. So for instance, some of the social distancing measures like shelter in place And then even things as we had moved along the spectrum, like mass events, larger gatherings, all of those things will be on the table as we start to unwrap the process. So people can expect that it would be a gradual return to normal over time. And the idea of it is to prevent another sudden surge in cases. How effective we are at that will help determine how that repeat peak might look. And certainly with viral infections, we have to consider that possibility that we will see more than one wave of this within any individual community.
That's all the questions for today. Thank you very much, Dr.
Thank you.
Frankovich.